Halloween, of course, 2 days away. But as COVID cases continue to rise, more Americans want to find ways to celebrate while still staying safe. Family physician Dr. Caudle is joining this morning with some Halloween do's and don'ts. Love your Halloween colors. Don't think I didn't notice.
I'm glad you noticed. Yes.
Of course I did. My first question, which I think the question is for everybody, trick or treating, is it a hard no?
That is a hard no. That is right. Traditional trick-or-treating, the way that we know it and have known it in years past, that is a hard no, as well as a few other things, just to be clear. Trunk or treating, the idea of passing out candy from like the trunk of a car, being in a parking lot, that's a hard no. Haunted houses, indoors where people are yelling and screaming, hard no. Crowded costume parties, indoors, all that kind of stuff. That stuff is a hard no.
So we need to find things that are outdoors. That's the first step, that we're headed in the right direction, right? So originally when we started talking about this way back when, Dr. Caudle, I thought, well, I'll just put a big bowl filled with candy at the end of my driveway and kids can come and get it. But that also is not the way to go.
Well, you can actually set up individually sort of wrapped bags for kids to take. That is not a bad idea. This is the year to get creative, and this is really what we want to do. I know we have a full screen up with some CDC recommendations about things that you can do. There's a number of things. The idea of like sort of carving and decorating pumpkins, decorating the house. You can do virtual costume parties, which is kind of which is a nice idea. And the CDC does say you can set up a station with individually bagged treats for kids to take. So that is a possibility as well. But the idea is you got to stay safe. 6 feet away still applies. You still got to wash your hands and all that good stuff. Of course, we want kids to wash their hands before they eat the candy. And the other thing I should say, though, is about masks. We still want to be wearing our cloth masks. And keep in mind, everyone, that costume mask, like if a mask comes with your costume, that is not a substitute for a cloth mask. So you want to keep that in mind.
So does that mean you need to wear your cloth mask and then the mask goes over it?
That's a really great question. We actually don't want you to do that. We don't want you wearing two masks. So that's a perfect question of, okay, so do we put the cloth mask on first and then the costume mask? The concern with that is that there'll be difficulty breathing and other issues, okay? So we don't want that. Make your cloth mask part of your costume. Decorate the cloth mask. Get creative with it. We don't want both, and we don't want you to substitute the costume mask for the cloth mask. You want to stick with that cloth mask. Just sort of incorporate it. Get creative, as I always say, and have a lot of fun with it.
So this isn't the year for a mask that covers your entire face. That's the moral of that story, right? We kind of set those to the side, and we need to make the cloth mask a part of whatever our costume is.
The cloth mask, but remember, you can still do stuff with the eyes. You can still do stuff on this part of the head. So you can I can't wait to see all the creative things that kids and parents are going to do this year, because I think it's going to be an interesting year.
I just want to make sure that I understand the handing out of the candy. So you said we can have like individually wrapped candy bags. Now, should kids come up and get them on their own? Like, how would that be different than them reaching into a bowl with just candy in it? Or should I be there at my house, maybe with gloves on, handing out the individually wrapped candy?
Okay, so those are all really great questions, and I'm going to read directly from the CDC so we have the exact language, and then we can kind of break down what I would recommend.
Right.
So the CDC says you can set up a station with individually bagged treats for kids to take. Okay. One thing I would not do is, to your question, you asked about should you be at the door. I would not be handing out these individually wrapped bags, because in a sense, that's the close contact, that's the person-to-person touching. We don't really want that, okay? That's almost kind of like the traditional trick-or-treating. What I would do is set them out at a designated place where kids can grab them. They can be social distance from one another. They can come take them themselves and keep on going.
Gotcha.
Of course, you want it to be sort of safe. You want the kids to be safe. Again, parents, make sure your kids are washing their hands before they eat any candy. They're using their hand sanitizer. Throw some hand sanitizer in their pockets, that type of thing. So that's the language from the CDC. But yeah, we don't want people handing that out. We want people to be able to sort of to pick it up themselves and keep going.
Also one last thing I just thought of, should you try in your neighborhood, if you can, to do like one way, like down one side of the street and come back the other way? Because, usually you kind of like crisscross people.
Yeah, well, it's certainly not a bad idea. And I think there's a number of ways to do it where we're socially distanced as possible, and that's the name of the game. We can't be in groups. We can't be in crowds. We need to stay away from each other, still wash, well, we can't wash our hands when you're outside, but obviously using the hand sanitizer and things like that. And make sure that you don't have contact with the person that's handing it out. We just don't want those types of things. So I think there's a number of ways to do it.
Who knew it was going to be so difficult? But we can do it. That's the moral of the story. We
Yes.
can trick or treat. We just have to be creative in how we do it. Dr. Caudle, thank you as always. You always have such great advice for us, and we always appreciate it.
Thank you.